If you're anxious about dental treatment, then you're not alone. Many people experience some anxiety during a visit to the dentist. Some even avoid a trip there altogether. But there is hope for the dentally challenged. Lasers are becoming an alternative to the traditional drill when treating cavities. And now researchers in Singapore are hoping to use the laser as a preventative tool. Susan Yu reports.
Bill Kong enjoys the simple pleasures in life. He occasionally indulges in sweets and enjoys collecting antique cameras as a hobby. But ask him about his biggest dislikes, he doesn't hesitate to say it's getting on a plane and...
When was the last time you saw a dentist?
Ooh, must have been like 15 years ago. You know, I'm still very scared of going to see the dentist.
Bill's phobia of clambering into the dentist chair is shared by nearly 60% of the general public, according to a recent survey. Bill's anxieties began when he was 7 years old.
Just like the night before, I couldn't get to sleep, you know, because so frightened of like the next morning, you know, going to the dentist.
Now where a lot of the things that people perceive to be problems in visiting a dentist don't really exist anymore. A lot of dentistry now is actually quite comfortable and painless.
And these days, high tech.
We are able to use much higher powered drills now, which make the drilling process faster and less uncomfortable. We're also using new technology like air abrasion, where the drill is not used anymore, but a high pressure jet of aluminium oxide is used to actually clear the decay. And that can even be done without local anesthetic.
In Singapore, another method of dentistry has cast a new light on the tools of the trade.
The use of high technology in the field of dentistry is nothing new. In fact, laser technology has been used on soft tissue treatments for decades. It was only until 1997 that laser technology was approved by the US government to replace conventional drilling. But the application for preventative care is still in uncharted waters.
Since the 1980s, lasers have been used for oral procedures, eliminating diseased soft tissue and bacteria with precision and virtually with no pain or bleeding. And in the past decade, the technology has been used for hard tissue procedures, such as teeth whitening, preparing cavities for fillings, and bonding crowns, bridges, and other structures found in dental work. But never before has laser technology been explored as a means to make teeth stronger and more resistant to disease. That is, until now. At the National University of Singapore, researchers have come up with what they believe to be an unprecedented laser treatment that guarantees 98% protection against erosion.
Basically, our tooth structure is composed of 97% of mineral in a crystal form, and just like a building blocks that we have. And inside this building blocks, our enamels have some impurity. And with that impurity, we have some weak point that when acid attacks, the whole building can tumble down. When laser, with the energy, right energy and parameters, they can strengthen, they can kick out the impurity and purify the crystals and make it stronger, more stable, more so-called acid resistance.
And less acid means less decay. But are there any risks?
It should be very safe if we use properly. But if we use wrong power dosage, then it can cause some harm.
Dentists using the laser procedure would have a choice of dosages to choose from for their patients who have different eating habits and levels of impurities in their teeth.
If a chocolate lover, then probably they would have to come more frequent than the other one who doesn't take in a lot of sugary content.
Researchers are now testing laser-treated teeth by submerging them in a sugar and acid-loaded liquid.
This is a chemical models we use to test acid resistance of the tooth structure that we have applied different dosage of laser. And inside the solution, there are different level of acid we'll be evaluating the mineral loss from the tooth structure that have been treated.
Dr. Su's team will be conducting clinical trials later this year to see if the science stands up in practice.
We are moving away from surgical model, meaning use surgical removal. Now we are in the prevention models, meaning we try to tackle the risk factors and try to strengthen the tooth structure before the disease starts.
Dr. Su adds the procedure would be affordable and beneficial for the public, especially in Asia, where he says oral hygiene education is generally lacking.
My parents never taught me about oral hygiene. The only education I had was at school, when they taught me how to brush my teeth properly.
Certainly the Caucasians that I see, generally speaking, have better oral hygiene, but the Asians are improving by leaps and bounds.
As the field of dentistry leapfrogs into the 21st century with its latest high-tech defense against tooth decay, there are still those who believe the best bet in protection is low-tech care. And that's practicing good oral hygiene at an early age by making sure teeth are brushed frequently and properly.
That's it.